in today's environment for physicians, you have to be creative. You have to, and I think physicians are uniquely qualified to understand the medical aspects of this facility and what can go inside of it and what could be successful over someone like myself. And that's why we always had healthcare professionals team up with us. So, for physicians to focus on, the service lines and the medical uses, I think it's important in understanding that they believe those uses are going to be successful today, but also successful in the future. It's imperative, though, and we said this before, that you team with the with a real estate professional, a development firm, because it's a very expensive proposition when you make a mistake and something doesn't happen. You can assume that you're going to spend, if a project costs $20 million, you're going to spend a couple $1 million, through architecture, engineering, third-party reporting, surveying, legal, before you even start construction.
This week on the Providers, Properties, and Performance podcast, I have the pleasure to interview Todd Bryant, President and Managing Director of Healthcare Development Partners. Todd entered the healthcare real estate market in its infancy and is still delivering projects to the market based on the current real estate needs of various healthcare service lines to deliver care. Join me as we listen to his story. So, Todd, welcome to the Providers, Properties, and Performance podcast.
Good afternoon.
So let's start with the history of Healthcare Development Partners. How did you get started and to get to where you are today?
I was in commercial real estate in the late 80s and had an opportunity to go to work for a healthcare developer up in Wisconsin. I spent a couple years with him, and then the recession hit, and I stayed in healthcare. I started Healthcare Development Partners in 1992, and we're going to, next year we'll be 30 years old.
And what are some of the biggest changes you've seen? I mean, you've been in healthcare real estate for quite a long time, from, where it started and kind of where it is right now.
Yeah, it's a lot more sophisticated, I guess. But when we started in the 90s, I think, our clients were all hospitals or healthcare systems. On budget, on time was a big deal back then. A lot of people had a hard time achieving that. And so, guaranteeing a timeline and a budget was a big value proposition for our clients and our projects. I think today that, that's an expected outcome pretty much. And, the level of sophistication at the healthcare system and hospital level is much greater. Our projects have changed a lot too. We do a much more integrated facility today than we did back then. Where we had individual physician suites and some hospital space. Now it's really more of an integrated outpatient facility, and that's come a long ways.
Yeah, I think outpatient is where a lot of this is going. So what made you decide to go into commercial real estate in the healthcare real estate space? Was it just your first job got you there and you got hooked?
No, so I worked for, I'm from the Midwest. I went to Madison. I came to Chicago. I wanted to be in real estate. I started in investment banking and, really to get to the real estate company I wanted to. There was a company back then called Equitech. They were out of San Francisco. They were a syndicator. Back then, there were tax strategies that were pretty attractive to investors. And so when we were part of that, there were a number of commercial downtown office buildings in Chicago I was involved in. And then I started looking at doing my own projects in and around Chicago. I got into the healthcare field basically, to get more experience in development. I was, in my early 20s, and the lenders were looking for me to have more experience. My projects were getting larger. And so the idea was to go up to Milwaukee, work there for 2 years, come back and build downtown, office buildings. And then that recession hit. And I sort of got stuck in healthcare. The commercial real estate office market basically collapsed for, a number of years. And it was very fortuitous because that, healthcare real estate is not as cyclical as a number of other sectors in real estate. So I'm very blessed to have that. I worked as a minority partner for another firm, and then again started Healthcare Development Partners in 1992. Basically it's we watched the business continue to grow. I think I remember the first BOMA conference, there was probably 30 people there, and now they have them all over the country and multiple locations, and so the industry just has exploded, and it's changed, and we're excited about the future.
All right, so HDP leadership includes both real estate and healthcare professionals. So how do you think this expertise working together strategically helps you?
So healthcare professionals and people who were in the administration for hospitals or in that type of setting are very important back when back in the 90s and in the early 2000s, we didn't do a lot of work that the hospital needed to get board approval. These projects would, sit on the drawing boards for a long time. And so, we did incremental revenue assessment, utilization analysis. We did all this in-house and provide that to the hospital, at no cost to get us closer to starting our project. We only make money when we build projects, turn a shovel of dirt. And so hospital administrators really spoke that language. They had a level of confidence with other administrators. And those personalities are really different. I mean, when we have people coming out of a healthcare system, their personality is a lot different than someone who comes from a real estate background. And so you need both of them, because a hospital setting is got a very sophisticated operating platform, and they have all kinds of different requirements and needs than a typical commercial real estate office building or project like that. And it's really important to be able to understand those sensitivities. I mean, there's a lot that has to happen that going into making a healthcare facility successful, and these people have really been a big part of what we've done over the last 3 decades.
Yeah, and you can't. Medical office buildings are kind of one structure, but when you get more specialized, you can't build it and hope they will come. You have to really build it for their need.
Correct. And that's a really good point, Tricia, because understanding how the building is going to be utilized is critical. And, trying to build sort of even today a building without really understanding what type of use will be in that building is a high risk proposition.
Mm-hmm. Absolutely. HTP has some interesting differentiators I was looking at, and among them, you have this guaranteed price program. So tell me about this.
That it's been around since almost the beginning, and what we do is, again, with hospital clients, especially second-tier community hospitals, being able to guarantee a total project cost and guarantee a delivery date is something that gets back to our roots of being at-risk developers. We don't do any consulting work. We don't do any program management. Again, I think I emphasized we go at risk for all the pre-development expenses, and so we're pretty careful about what we do. So, but the idea there was to remove these projects are a major investment by these second-tier hospitals, and they are for primary markets too. But if we can remove the risk on the cost and go at risk for the timing, they're hiring doctors, they're buying equipment for these facilities, and they need to know that that building's going to be there on this date. And if it's not, what are the penalties? And so we eliminated that risk for them, and it's a very successful program, and it allows us again to align with our clients from a standpoint of delivering these projects. And if we don't do what we say we're going to do, then we have to suffer the cost consequences and so forth, and we pick that up. And I guess the correlation is not just the project costs; it's mostly because they're tenants. It's the rent that they pay, and so we give them a rent number day one, and we live by that rent number. Even if the project costs go up, that means our returns just go down. But they need to know that rent number, and a lot of other firms, just never did that.
Yeah. So in Arizona, specifically, you have several success stories: St. Luke's Medical Center, Sierra Vista Regional Medical Center, and Sun Health Ambulatory Care Clinic. Do you want to highlight one for the audience and share the case study and story behind it?
So I think, Sierra Vista, it was a great project. It was actually in the central coast of California, and I'll talk about the other one, but that was for a large system. That was for Tenet. California has a lot of nuances that make development very challenging, very difficult. So getting a project built in California, you should be proud of, especially, in the Central Coast area where, development pads and sites are very hard to find. That was a building that it was more traditional medical office building because it was on the campus of Sierra Vista. And it was housed, again, more traditionally with the hospital taking the first 2 floors, and then we leased out the other 2 floors to the doctors. But we did have an integrated surgery and other parts of that. And again, that was a project that had a lot of development challenges. The one up in, for Sun Health, we talked about a little, but that was another project that was pretty interesting because we were up in an area that was sort of on the outskirts of, Phoenix, north of Scottsdale. And, Sun Health at the time, was an independent healthcare system, and they were, increasing their footprint up north into that corridor. And, we had started the project, we were basically enclosed, and Sun Health was bought by Banner. And that created a number of challenges, ultimately leading to us replacing Banner with Vanguard at that time as an anchor tenant in a sort of a challenging market too back in the last recession. And so there were a lot of things that, a lot of curveballs in that project, but we stayed with it, and it's filled today. And again, I know it's a good success story for Phoenix.
And that's a great example of pivoting, huh?
Yeah, unexpected pivoting.
Forced pivoting.
Forced pivoting, exactly. Yeah.
So where does HDP focus its efforts geographically, and why do you pick those markets?
So I guess, we're definitely national. We've built in 30 states. I think, we like to go into growth markets or second-tier markets, sort of separately. Today we're in, we're as far east as Virginia. We have a number of projects out east in Virginia, Texas, Arizona, California, Illinois, state of Washington, Missouri. So we're pretty much all over the country. We have our core business that, is what we've always described, which is the at-risk facility development for healthcare systems. And then we've tried to focus into some service lines that we really think are going to be growth opportunities, in the future.
And just for, I think some large independent physician groups, they do consider developments for their projects. One, because they can build it as they need it to be, and then, put other tenant mix referral systems in place. And just, I think and I may just be speaking for Arizona, but the development here for, I would say, medical office buildings has been, I think, pretty well managed since, 2008 and 2009. So, I want them to understand as a developer, the amount of upfront costs that you go at risk, from buying the land, if you have to do anything to rezone the land, all the upfront architectural engineering costs and everything before you even get to the design of the building and start, putting it in place. So can you, kind of summarize that maybe a little more eloquently than I just did? But
well, no, I think that it's a good point. I think that, I think first of all, today in today's environment for physicians, you have to be creative. And I think physicians are uniquely qualified to understand the medical aspects of this facility and what can go inside of it and what can be successful over someone like myself. And that's why we always had healthcare professionals team up with us. So, for physicians to focus on the service lines and the medical uses. I think it's important in understanding that they believe those uses are going to be successful today, but also successful in the future. It's imperative, though, and we said this before, that you team with the with a real estate professional, a development firm, because it's a very expensive proposition when you make a mistake and something doesn't happen. You can assume that you're going to spend, if a project costs $20 million, you're going to spend a couple $1 million, through architecture, engineering, third-party reporting, surveying, legal, before you even start construction. And then oftentimes, you're not going to be able to open a loan until you have a lot of these items in place, because a lender is going to want to know what the project's going to cost, and you can't tell them what's going to cost until you have production drawings and you take it out. And so it's a big proposition. I think it's a good opportunity for physicians to be able to create additional value based on what they do for their career if they're careful. I mean, I think we see a lot of unsuccessful physician-based facilities that just weren't well planned or weren't well thought out. I think people really don't understand that process. But as much as I think physicians need real estate professionals, we need physicians to put that together.
So if a physician group comes to you and they want a little bit of the economic benefit, do you have programs in place for limited partnerships of the physicians if they bring if they're coming to you, almost, I would say maybe a build to suit with a little bit of extra space, and they obviously sign a long-term lease? Have you done that in the past?
Yeah, we've done a lot of that. I mean, I would even take it a step further. If there's anyone who listens to this and wants to get advice from us, we're happy to talk. We're happy to give them a financial pro forma. We're happy to talk about what we think of the project and the likelihood for success. And we do that at no cost. I mean, we also are well capitalized, so we can put up the equity for the facility. We do form joint ventures with physicians and physician groups. Have done that numerous occasions. And again, we're not consultants. So when someone calls us, we give, our advice and what we think. And we're pretty candid about it because we want to be careful with our time too. So we'll give you a pretty honest answer on what we think. And if there's an opportunity to work together, we love that opportunity.
So I want to move on to, your work in behavioral health. So, one of your missions you stated is excellence in behavioral health. So how many facilities are you currently working on, and do you feel that they're even remotely keeping up with the demand?
Behavioral health is something we looked at about 5 years ago with a couple other service lines, and spent a lot of time doing a couple things. One was working to get an exclusive joint venture with an operator that we really would feel comfortable with. Moving forward with an exclusive JV relationship. And so we have that relationship with a firm called Signet. They're out of Dallas, Texas. They currently operate 80 facilities. We're planning to do, start construction on 4 in the next year, 2 in Texas, 1 in Kansas City, 1 in Indianapolis. Our idea is, we're looking to build, these facilities in markets where we can either, we have a prototype that took about, 15 months, 16 months to develop. And it allows us to either build basically a 50-bed facility, but then it's expandable to 100 beds. And so, these facilities are full-on I-rated hospitals. And so there's a lot that goes into them, a lot in the staffing and so forth. And so we tried to create some flexibility so we could go into other markets that maybe some people wouldn't necessarily go into, and get started with a smaller facility, and then be able to expand it as the demand allowed. We see unbelievable demand for we have no shortage of opportunities in behavioral health, and it gets back to the patient that's coming into a behavioral health facility doesn't fit well in a traditional emergency department. And so there's a lot of disruption for hospitals in the ED of trying to care for these patients, and having a specialized facility adjacent or close to is really, a benefit not only for the behavioral health hospital, but also for the hospital that has, much broader patient base.
Yeah, no, I would agree with that. And then, your ventures seem to follow the market demand, and HDP is, going into, COVID testing labs. So tell me why you started to focus on this.
So we got
into, obvious.
Yeah, well, we got into the lab business really because of the behavioral health business. And we like the lab business. We think that, some of the larger players, Quest, LabCorp, it's not a very customer-friendly service for a lot of people. And so, we looked at looking at toxicology and behavioral health and some of the other ones as a primary reason to enter this. We made that investment without knowing that COVID was around the corner, and then COVID, sort of came upon us, and it's, the COVID testing we see is very robust right now, but it probably will have some element of that going forward. Certainly with our, senior housing operators and skilled nursing operators and so forth. And so, that business line, we're looking to expand nationally. I'll mention we're very interested in acquisition of existing labs to support our demand, or opportunities to develop new labs. So, to all the physicians or anyone else out there who, may think that there's an opportunity for the lab business, let Tricia know and let us know, and we'd love to talk to you about it, because we see this, staying here for the long term. We have a lot of relationships too with smaller community hospitals, hundreds, almost 1,000. And so we'd look to also capture some of that. Our business will be really tech forward, very user-friendly, and I think we can do a better job than what's being done right now. And we hope to consolidate this in the lab industry in the same way we've done in some other service lines in healthcare.
When I have this question, and I would think that, your approach has always been so sound that the pandemic hasn't affected you, but has the pandemic affected your approach to pursuing opportunities, or is it always the same,
Well, I think, so the biggest issue is we have second quarter of 20, we had $300 million of projects coming out of the ground, and or about to come out of the ground in some form or fashion. We got about, half of those going, and then, we sort of froze up in financing lenders, especially in the long-term care senior housing type market. And so they got hit really bad. We had two big projects that, we're sort of put on hold. We're getting ready to get going right now. But, that was the biggest aspect of the pandemic. I think, obviously addressing infectious disease in any healthcare facility going forward is going to be an important element. I can tell you in senior housing that, our approach in senior housing or active adult is to align with hospitals and healthcare systems. That's what we do. I've mentioned to you that one of our biggest assets is not on our balance sheet. It's our relationship with hospitals. That we've taken 30 years to develop. So when we do a senior housing project, whether it's in Scottsdale right now at Sierra Bloom, or whether it's in Virginia, with Valley Health, we align with a hospital strategically, not financially, so that the hospital will have software that will see what the residents are doing, and can get in front of preventive care and get in front of an event. And so they have bracelets for movement and other software, so they know what's going on with the medication, and vice versa. The operator then has more access to healthcare. And I think with COVID, being able, if you have a loved one, or adult children who have parents in a senior housing community, having that relationship with a hospital is really an important element of feeling more comfortable that they're going to be taken care of, and there's someone to really address some of these issues that came out of COVID.
Yeah, absolutely. So in your opinion, where do you see the outlook on healthcare, let's say maybe 12 to 18 months here, and then, maybe 3 to 5 years out?
Yeah, I'm very bullish on 12 months out. I think, we all said that there's buildings in Chicago that are office buildings that are 100 years old, and people love those buildings and they want to be in them, and they're almost as efficient as the new ones today. But in healthcare, facilities, we all said, almost every 7 to 8 years needed to be remodeled or have some piece of technology changed out, whether it's imaging or some type of surgery, OR. And so now with COVID and all this, I mean, I think it's really going to be a robust time for facility development, for new technology. I think like we talked about in senior housing, active adult, behavioral health. I mean, these are all things that have very big demand, and the healthcare sector, healthcare real estate sector has grown so much that it's a lot more sophisticated. And for firms like us, our pipeline is full. I mean, we have a lot of projects on the drawing boards just for the next 12 months, and I think over the next 3-5 years, it's going to really change. I mean, telehealth will go into smaller markets. That's another opportunity for physicians to introduce more service lines in an affordable way. There's just a lot. I mean, we haven't even talked about some of the things we're doing with the group homes, small assisted living group homes and memory care, where people can't afford to have a 120-bed senior housing project. We can build a single story group home and deliver those to hospitals, community hospitals, or physicians, and have 12 to 16 residents in that group home, single story, stick built, at about a third of the cost to build one of the big ones on the community. It offers a lot. There's pros and cons, obviously, but the pros outweigh the cons, and you can get a population base or a patient base, and one that maybe it's assisted living, maybe one's memory. A lot of these community hospitals are going to be looking for step-down facilities. Not sick enough to stay in the hospital, but not well enough to go home, or physical rehab. And so it affords a lot of flexibility in meeting demand and at a much better cost point too. So I'm excited.
Yeah, I think these healthcare ecosystems are prime, where the acute care hospital does its job, but then nearby, like you said, you have other outpatient services that help the intermediaries, and then the full-on outpatient. So I think that there's a lot of opportunity in that concept, and not just from acute care hospitals, but cancer centers or orthopedic rehabs and stuff like that.
Yeah, absolutely. I mean, all of that's going to, and we always want to bring healthcare closer to where we live. And with technology today and some of the things we're doing, we can do a lot more on an outpatient basis. And so a lot of the facility development, maybe they may be a little smaller, but they're going to be closer to where people live, and not necessarily have to be on a hospital campus. A hospital campus is very stressful, parking structures, signing in, signing out of different. So the more that we can eliminate patients that have to go to a healthcare campus and go to an outpatient setting, the better it is for everyone, and it's lower cost of delivery too.
Absolutely. All right, Todd, we're going to move into the Q&A section. So what was your first job?
My first job was at Prudential Base Investment Banking. Prudential had an investment banking arm. I graduated college. I read a book, 100 Best Companies to Work For, and in that book was Trammell Crow. And they said, if you want to be a millionaire by the age of 25, this is the company you should work for. And I wanted to be in real estate, and that sounded pretty good. And so I had 7 interviews with them. I won't name names, but I had 7. I didn't know them as well. They went on to have very good careers, and I did not get hired. And so then I went, I got a job with Prudential Base in investment banking. I stayed there for 18 months, and got the job with Equitech after that, and got into commercial real estate.
What would you be doing for a living if you weren't working in the healthcare real estate industry?
Oh, that's a good question. I'm pretty competitive, so I don't know. I'd be a downhill skier. I mean, I would, or maybe boat racer. I don't know, but I mean,
something adrenaline based.
Something sort of type A. Probably not a bullfighter, but.
Who are you reading or listening to right now for news, information, or inspiration?
So I guess I try and find stuff that's sort of balanced. I mean, it's difficult. So on the news, I'm a big fan of David Muir on ABC. I mean, he seems to be okay. Wall Street Journal, I read that every day. And that I do like Forbes, and that, but that's about it. I mean, as far as the information, it's hard to listen to too much of it. I mean, it's a little depressing.
What is one thing you do every day for healthy self-care?
Well, I do work out every day, and so that it's usually cardio. I love cycling, so wherever I'm in, weather permitting, do road cycling, Peloton inside, and then sometimes I go to the to the gym, the health club.
And do you feel that leaders are born or trained?
I think both. I mean, I think you can have it both ways. I think it helps to have a certain, natural personality that wants you to be, in the front. But I also think that you can certainly have, training and management skills taught to you